Hello, and welcome to Wellness Wednesday with Dr. Latoya Wells. I am Dr. Latoya Wells, family nurse practitioner, doctor of nursing practice, owner of Wells Legacy Health and Wellness. We are here for another episode of Wellness Wednesday. Tonight, we're going to be discussing sleep, insomnia, and how that impacts your overall mental health and well being. As you know, or you may not know this, but July is Minority Mental Health Awareness Month. And so, as we begin to discuss some of the things that impact our health, sleep is one of the things that is so important. And it's something that I have had many conversations with individuals over the last couple of weeks regarding their sleep patterns, sleep habits, lack of insomnia, you name it. So tonight we're going to be talking a little bit about sleep and how it impacts your overall health. The lack of sleep, what have you, how that impacts your overall health. And so it's recommended that we receive or that we get between 7 and 8 hours of sleep a night or a day, depending on if you are a shift worker and you work different shifts and you may work overnight or what have you. But the recommendation is 7 to 8 hours of sleep each night. Our bodies has a circadian rhythm, and if we're in sync with that rhythm, we typically sleep at night. However, we do have individuals such as healthcare workers and other individuals in other fields who work different times of the day. And so we'll talk a little bit about that. But I want to really focus on our health in terms of our sleep and how lack of sleep impacts our overall health. And it's a topic that we talk about, but we don't really spend a lot of time providing education on and figuring out the ins and outs of what's causing this individual to not be able to sleep. And so let's dive into it. So, sleep is so important, it's so crucial to our overall health. Um, Insomnia is defined as difficulty falling asleep, staying asleep, or waking up too early. And so I'll have patients tell me, I only get like 4 hours of sleep. I'll go to sleep at 8 and I wake up at 12 and then I'm up for the rest of the night. Or it's hard for me to go to sleep. So I'm sleepy, I'm tired. My body's telling me that I need to go to sleep, but I cannot fall asleep. Or I go to sleep and I'm waking up every couple of hours. And so you're not really getting that deep REM sleep that you need to be able to replenish your body, to get the rest that you need. And so we got to figure that out. Individuals can have chronic insomnia or acute insomnia. So chronic insomnia is defined as something that occurs over a long period of time. Acute insomnia is when there may be some stress going on, or there may be something that's changing in an individual's life, and they may have an issue with falling asleep, staying asleep, or waking up too early a couple days, right? And then they go back to their normal sleep patterns. So it's chronic or acute. The key is getting to the bottom of what's causing the insomnia. Like, what's causing this? Why is this individual having issues sleeping? And I don't know about you, but I've dealt with insomnia. And I'm very transparent. In 2021, 2022, I really dealt with some really bad insomnia, and it was because a major event happened in my life and in my family's, in my family, that caused a lot of stress and chaos, and I just could not sleep. And I am very sensitive to medication. We're going to talk about treatment, but I just want to talk about this really quick. I am very sensitive to medication, so it was hard trying to find something that I could take that wouldn't have me groggy for 2 or 3 days afterwards when I just could not function. So some of the causes of insomnia, as I just mentioned, stress is number one cause of insomnia. The next one is anxiety. And then depression. These are psychological factors that impact an individual's ability to sleep. Stress, anxiety, and depression. When an individual is stressed out, when they're anxious, and when they're depressed, their minds is just, I can explain what I felt like. I just felt like my mind was moving a million miles a minute and it just would not stop. I was having all these thoughts and I just couldn't shut my brain down to be able to get into that rhythm of being able to go to sleep. Anxiety is another thing that causes individuals to have issues with sleep. And whatever the cause of the anxiety, one of the side effects of that is insomnia, and you can't go to sleep. And then depression is another one, and that we can get this. This can be a whole lecture on insomnia and the different causes, but I just want to be able to highlight and touch on some of the most important ones. Some of the other medical conditions that can cause insomnia is chronic pain. If you can't, if you're in pain, you can't really sleep, and so individuals with chronic pain have issues sleeping. Asthma is another one. If you can't breathe, then you can't sleep. And then another common one is GERD, which is heartburn, as we call it. But GERD is another reason. It's gastroesophageal reflux disease. And so that's where you have the reflux that's coming up of the food and the acids that cause an issue. And so those individuals will wake up gasping for air, or they'll wake up coughing or choking because the acid is causing them some issues and they can't sleep. There's many other causes of insomnia, but we're just highlighting some of the common ones. Lifestyle factors, so irregular sleep schedule. If you're an individual that works shift work and you work 312s, and I'll just kind of bring up the example of healthcare workers because that's what I know. I remember working night shift and I worked 3 12-hour night shifts. And the other 4 days that I was off, my body was like, hey, wait, what's going on? We're supposed to be sleeping during the day. But I have a family who's on a regular, shift with their sleep. They are up during the day and sleep at night. So I would try and adjust myself to blend in with my family, and that just didn't work. Poor sleep environment. We have to make sure that our rooms, or where we sleep, our bedrooms, is for sleeping, right? I know there's many individuals who have TVs in their room. I'm one. We have the TV in our room. I spend a lot of time in my bedroom. That's my sanctuary. And so I'm comfortable there. I'm at peace in my room. So I do a lot of things in my bedroom. And to be honest, a lot of those things take away from me sleeping or distract me from having a good sleep hygiene schedule, or things that I put into place. And so we have to really take a look at that. Caffeine, and then also alcohol. Not saying that we can't have caffeine, we just have to do everything in moderation. Not saying you can't have alcohol. Again, everything in moderation. If you are someone that drinks coffee, you have to be mindful of when you drink coffee. Or if you're an individual that drinks sodas or pop, or some people call it, you have to be mindful of when you have that last caffeinated beverage or food. Chocolate is, you know, has caffeine in it. Some chocolate can have alcohol in it as well. So we just have to be mindful of that. So when I have a patient that comes to me and we're doing a physical exam, and again, you guys know I'm going to tell you what you should be expecting when you go for your physical exam. Your provider should be asking you about your sleeping. How are you sleeping? How much sleep are you getting? Are you waking up during the night? Do you wake up feeling rested, or are you waking up tired? Are you sleepy in the midday? We need to find out what's going on. And the only way to do that is to have a conversation about it. So if your healthcare provider is not asking you these questions, you need to, rethink that, or you need to bring that up if you're having issues. Some individuals feel like, oh, this is just normal. I shouldn't sleep, 7 to 8 hours a night. Well, that's not the case. We should all be getting at least 7 to 8 hours a night in order to get restful sleep. I do know that there are medication, there's different treatments that can be done to help individuals sleep, but I tend to want to look at non-medical things first, and we'll talk about that in a little bit. So, what is sleep hygiene? Sleep hygiene is just like we, do our physical hygiene. We have a routine when we get up in the morning. We do our morning and in self hygiene. You get up, you wash your face, you brush your teeth, you take a shower at night or in the morning if you're a morning or night shower. And then you get dressed, you put your deodorant on, you do these things. You have your routine that you do each and every day. And so sleep hygiene is just that. It's different things that you put into place that help you prepare for bed. One of the things that I had to do was I found myself, especially when I was having insomnia really bad, whenever I would wake up or I couldn't go to sleep, I found myself scrolling on the internet. I'm on social media, I'm on my phone playing games. And so that was a big distractor for me when it came to going to sleep, because now I'm sleepy, but I can't go to sleep. So I grab my device, which then further stimulates me, and I'm just not able to go to sleep. And then, before you know it, it's 2 hours and I'm still scrolling social media. So, what are some good sleep hygiene practices? One, a consistent sleep schedule, going to bed and waking up at the same time each and every day. One of the ways that this tricks me up is um, I work, so I'm up at a certain time each day. My work day starts at this time every day, Monday through Friday, and I'm typically off by a certain time each day, right? And so during the week, Monday through Friday, I'm good with my sleep schedule in terms of getting up and having things in place. It's the weekends that get me, because on the weekend, I don't want to get up at 6 o'clock in the morning. I don't want to get up at 5 o'clock in the morning. There are many days where I'm up at 5 or 6. Some days I'm not. And so just being consistent with your sleep schedule. Um, Making sure that 7 days a week that you're getting up every single day at the same time. That way your body kind of gets used to, okay, we're getting up at 6, or that alarm clock goes off and you're up, and then you begin your day. There are individuals who have this internal clock that wakes them up every morning. They're awake every morning like clockwork, no alarm, nothing. Their bodies have just been conditioned to wake my husband between 4:30, between 4 and 5 o'clock, he's up. No matter what. If we're on vacation, if it's the weekend, he is up. And we have individuals who are like that. Sleep environment. So making sure that you have a comfortable mattress, that you have pillows that are conducive to sleep, that it's a cool, dark room, and that there's minimal noise. My bed is very comfortable. We have some really good pillows and things of that nature. I set my thermostat to a certain temperature at night so that I can get, it is cool in the room. And for the most part, my room is pretty dark. We have a TV in our room, but we don't sleep with the TV on. And so there's where we're minimizing the noise. What I had to do was I had to set an alarm on my phone for my phone to go into sleep mode at a certain time. And so every night at 10 p.m., my phone shuts down, and I can only use critical features on that phone. So I can use the phone and I can get and receive text messages, but all of the other apps are shut down. In order for me to get into them, I have to put in this long password, ridiculously long password, to get into that. I took it off here recently, so I just kind of used my fingerprint or my finger to open it up. But I'm going to go back to that, because when I was having insomnia and I couldn't sleep, the first thing that I would do was grab my phone. Or if I would wake up in the middle of the night, first thing I would do is grab my phone or my tablet. And so if I'm sleepy and it's 2 o'clock in the morning and I'm waking up, I don't want to remember a password that's 14 digits that I got to put in numbers and letters, right? So I put things into place that would help me fall back to sleep if I should wake up. So getting prepared, typically we should be winding down, right? At least 2 hours before our bedtime. So at that point, we're limiting screen time. If we are utilizing screen, we want to make sure that we have blue light on the screens before we go to bed. And most cell phones and tablets have the blue light filter, and many individuals who wear glasses have the blue light filter on their glasses. Um, some of the things that I like to do: take a warm bath, reading a book, journaling, meditating. One thing that I found was helpful for me was to do a brain dump. So at the end of the day, I have my journal as I'm preparing. I have my sleep pattern, um, different things that I do, my pre-sleep routine, things that I do to help me get ready for bed and to go to sleep. And so I will, at times, if I feel like I just have a lot of things in my head and I just need to get them out, I'll just do a brain dump and I'll just start writing all the things that I need to do, the things that I'm thinking about that I might need to do, stuff that I don't, did I really do this? Writing it down. And so that way I'm getting all these things out of my head onto paper. So I don't wake up at 3 o'clock in the morning and be like, oh shoot, did I pay this bill? Did I forgot to send that email. No, I've written it down. I'll take care of it the next day. So, taking a warm bath or a warm shower. Some individuals do meditation. I am a fan of all things Peloton, and this is not a commercial or anything. I'm not selling anything to anybody, but I will say Peloton exercising and their platform really helped me during the pandemic, and then also when I was dealing with depression and anxiety. It really helped me. So I'm such an advocate for it. But they have meditation, they have sleep meditations on there. So some individuals will listen to, calming music, something like that, to kind of help them get into a place of getting ready to go to sleep. And then avoiding caffeine, nicotine, heavy meals close to bedtime. All of these things put together can make up your sleep hygiene practices or schedule. And so, what are some of the things that can happen when we are dealing with insomnia? We're going to talk about that in a little bit. But some of the behavior changes that we can do to help us: deep breathing, muscle relaxation. There are times where I like to work out at night. And I'm an individual, I can work out, go take a shower, and go to sleep. Some individuals can't do that. So, what I try to do is once I'm done working out, I'll do some stretching. And while I'm stretching, I'm doing a deep breathing, things of that nature. There's also something called CBT therapy. There's CBTI, which is cognitive behavioral therapy for insomnia. So there's many different treatments and things that we can do to help individuals with insomnia. I will put my sister on blast. My sister worked nights religiously for years. And when she switched her schedule, it was so hard for her to sleep because she was so used to working nights. And so we have to be creative with, things like that. For individuals who work night shift and your sleep time is during the day, some of the things that you can do: blackout curtains, talking to your family and friends, and have your own sleep routine for when you get home in the morning, things that you need to do. I have a lot of friends and a lot of colleagues who still work nights, and some of the routines look similar to this. They get home, they have, well, which would be breakfast for them. They'll work out, take a shower, do a few things around the house, and then they'll begin to prepare themselves to go to sleep. Some individuals, when they get home, they take a shower, they're in bed, they're asleep, and then they wake up and start their daily routine before they go back into work. So there's many different things that you can do and many different techniques that can be put into place to help you when it comes to insomnia. So let's talk about mental health and how um, insomnia can impact an individual's mental health. I know for me, and I always use myself as an example, insomnia can increase anxiety and depression. There was a period of time a couple years ago where I was already dealing with anxiety and already dealing with depression. And so the lack of sleep compounded that. Prior to me, I took a leave of absence for 6 months from work. And prior to that, I wasn't sleeping. There were times where it was 3 or 4 days. I had not slept maybe 3 hours, but I was getting up, working, doing all the things that I need to do, taking care of my family. And it got to a point where I just could not do it. My body was getting ready to shut down. My mind was just like numb. I couldn't remember anything. And that leads to the next one, difficulty concentrating and memory problems. I'm a person that I can pretty much remember a lot of different things: debit card numbers, PIN numbers, account numbers for banks, account numbers for credit, different things, passwords. I was having such a hard time remembering password that I would enter in several times a day. And so it could impact your ability to concentrate and have your memory. So you can begin to have memory problems. Another thing is mood swings and irritability. When you're tired, you're cranky. And I don't know if I was cranky. Ask my husband and my family, they can tell you that. But I can tell you that mood swings and irritable. I was very irritable because I was tired, I was exhausted, and I could not sleep. And so, individuals who deal with insomnia may experience these things. And I would just say, someone would say something to me, and I would just snap, because I was so exhausted. But it wasn't their fault. It was what I was dealing with internally that I had to work through in order to be able to get back on a regular sleep schedule. So some of the mechanism is how sleep affects the brain function and emotional regulation. So when we sleep, our bodies go into this process of light sleep to REM sleep to deep sleep, right? And that's where we're taking deeper breaths. Our heart rate is slowing down. Our body is pretty much replenishing itself. Certain hormones are being released while we're sleeping. One of the hormones that's primarily impacted by insomnia is cortisol. And so individuals who's having insomnia and difficulty sleeping, their cortisol levels are kind of all over the place. And so it's important that if we were to draw blood work and we see this, one of the things that I tend to ask is, how's your sleep? Like, what's going on with your sleep? And so there's different phases of sleeping, and you're only supposed to be in the first few phases for a little bit before you go into that deep sleep. And that's really where we're able to just, our body's replenishing itself. But if that's interrupted, then you got to start all back over. And if you're waking up frequently, you're really not truly in that deep phase of sleep. And so you're not truly getting all the rest that you need to get. So, in terms of physical health, what happens to an individual's body when they are dealing with insomnia? I'm just checking my time. Cardiovascular wise, when it comes to the heart and the circulatory system, individuals can deal with high blood pressure and then increased risk for heart disease. And so when we have someone, I was at a patient, we had a patient and this individual had sleep apnea. We'll talk about that. I think we've talked about that before. But their blood pressure was increasing and they were having some other cardiac issues. Once they were able to fix the sleep apnea and this individual was able to kind of go to sleep, then they saw a decrease in the blood pressure and therefore a decrease in their risk for heart disease. When it comes to immune system, when you're tired and your body has not had the opportunity to reset itself and to replenish itself, you're more susceptible to infections and viruses and things of that nature. So when you're running on empty and you find yourself getting sick more often. And then there's an increased risk for diabetes and metabolic syndrome, and that's because of the fluctuations in the insulin levels, and your body's just not able to reset, and also cortisol levels as well. So sleep deprivation affects hormone regulation and body function, as we just kind of mentioned it. And again, there's many hormones that we see that may be impacted by the lack of sleep. So when it comes to weight gain, um, lack of sleep definitely has an association between increased appetite and obesity. So weight gain and obesity definitely are linked with poor sleep and increased appetite. Typically, when someone is not able to sleep, a lot of people go to food. So they're eating the junk food. They're up, throughout the night eating when they shouldn't be because we should be sleeping. And so the impact on the hunger regulating hormones, which is ghrelin and leptin, are the hunger hormones. They're really out of whack. They're not, their levels are not at a steady state. They're kind of all over the place. And so with that, individuals tend to be hungrier, they're eating more, and they're gaining weight. Um, Sleep deprivation leads to changes in metabolism because your body's not on a regular schedule. So you're up eating late when the body should be sleeping. So the metabolism is slowed down versus when you're up in the morning and you're in your regular routine, you're doing the things that you need, then your metabolism is kind of, on a regular routine or schedule, so to speak. And then increased cravings for high calorie foods. You're up at 2 o'clock in the morning, you can't go back to sleep. So for me, I know I would go grab some chips and some cookies, and I'm sitting, scrolling on social media, eating chips and cookies. Not good for me, right? No. So as a healthcare provider, it's important for me to understand my patient's sleep patterns and how that's impacting what's going on with them. I have a patient that comes in, I'm always tired, their blood pressure is increasing, they're gaining weight, their A1C is going up. In my physical exam and my review of system, and when I'm having that one on one conversation with my patient, I'm asking them about their sleep. Identifying sleep problems can definitely have potential underlying factors for different health conditions, as we talked about earlier. Diabetes, increase your risk for diabetes, obesity, heart related problems, many different things. And so we have to make sure that we are, as healthcare providers, that we are asking the questions, that we're providing our patients with solutions, that we're working together and helping them to advocate for themselves when it comes to their sleep hygiene. Because ultimately, it impacts every area of their life. They can't fully function in the way that they want to or should because they're so tired and their body is essentially shutting down. And we don't want that to happen. As a patient, it's so important that you are knowledgeable on what you can do to improve your sleep and overall health, and that you're putting into practice, that you're putting in place different things that you need to do in order to be able to get ready for bed or deal with the issues that's causing the lack of sleep or the insomnia. And then making sure that you're proactive towards better sleep hygiene and health habits. So, no screen time 2 hours before bed, no TV in the room if you're tempted to watch TV. Put the phone on lockdown mode at a certain point. Do things that you need to do, not eating, 3 hours before you go to bed. No caffeine within 2 to 3 hours before it's time for you to go to bed. Make sure you set your alarm and don't hit snooze a million times. I'm guilty, right? So there's so many things that we can do as individuals to help when it comes to our overall sleep pattern, sleep hygiene, and sleep habits that can help us. When you are not well rested, you don't make the best decisions. When you're not well rested, you just don't feel good and you don't want to exercise. You don't want to do the things that cause you joy and that you're usually enjoy doing. And so it's so important that we look at that when someone is dealing with insomnia. Thank you all so much for being here with me for another episode of Wellness Wednesday with Dr. Latoya Wells. We are here every Wednesday. There's some Wednesdays we may take off, but we are here on Wednesdays and we will be discussing different health topics. So Stay safe, stay well, take care of yourself. We're here if you need us. You can find us on social medias: Facebook, Instagram, TikTok, YouTube. You can always watch these lives on either of those platforms. You can also find us in office at 452 Osceola Street, Suite 106 and 107. Our website is www.wellslegacyhealth.com. You can book an appointment if you want to give us a call. Our number is 321-306-6755. Stay safe and be well. Until next time, this is Dr. Latoya Wells. Take care.